Hi, my name is Renita Henson. I am one of the transitions of care nurses and also the senior wellness nurse for our seniors here at Longmont United Hospital. I'm here today to tell you about a patient experience that I had with one of our patients for setting goals and making goals actually happen going down the road with her in her life. We met her at the hospital a couple of times, and then on the third admission, I was like, okay, so this isn't working very well. What's going on and what can we do differently? And we had a long talk, and she finally said, I just want to get strong enough to go home. And I'm like, but going home isn't working for you because we've sent you home 2 times before this. What can we do differently? So she thought very, very severely about it and came back and said, you know what, I think that with physical therapy, I can get strong enough to go home. And I'm like, okay, but what can you do for yourself in addition to physical therapy coming in and working with you? And she thought a few minutes, and the next thing I know, she's popping her legs up on the side of the bed and lifting them up, and she's like, I can do this. And I'm like, okay, that's a good one. How often are you going to do this? And she said, I'll do it every hour. I said, well, how many times are you going to do it? She goes, I can do it 5 times every hour. I'm like, okay, so your part is to do 5 times every hour, leg lifts to get leg strengthening and then work with therapy. Anything else you can think of? She says, I'd really like to get out of this bed. I said, okay, so how do you think you might go about getting out of the bed since you can't get up by yourself? And she says, I have no idea. I'm like, well, when the CNA comes in every hour for hourly rounds and they're working with you, part of what they're looking at is, are you moving? So would you be comfortable asking the CNA if she might walk with you for a quick lap around the hall? And she's like, I could do that. I could ask that. So she did that. And so for that hospital stay, that was her plan. That was what she did. She walked twice a day with the CNA. She did her leg lift. She walked with therapy. So we're all excited. She's getting ready to go home. And I'm like, all right, how are you going to keep this goal going when you get home? What are you going to do to walk when you get at home? And she thought about it. Well, I have home physical therapy coming. I'm like, okay, that's 2 days a week, maybe 3 days a week. What are you going to do the rest of the week? She goes, I really think I could handle it a couple of days on my own. I could probably manage to do the exercises. But I'm really afraid to walk outside. And what I really want to do is I want to go outside and I want to walk around my neighborhood, because when I did that, I felt so good. I'm like, well, I have this exercise specialist in the transition program that could come to your house and walk in the neighborhood with you. So how would you feel about that? And she says, oh, that would be wonderful. So we did all of those things. She worked with therapy. She did her exercises. The exercise specialist walked with her. When the weather got bad, they transformed that from the neighborhood to meeting at the rec center and walking on the track at the rec center. And she has done amazing and has felt so good and has been able to stay at home for a very long period of time for this time. So hopefully that helps you see, break those goals down into little tiny pieces. And again, but it's about that patient and what is it that's going to make that patient have some reason to do what it is that the goal is set for. So thank you for your time.